nga nankavaamu embuto 3 bane embuto ediviire mu ddonka diruma.
But for 22-year-old Annet Nangobi of Lugolole Village in Mayuge District, that journey was marked by repeated heartbreak before she finally became the mother of one child.
Hakuba ki nemunda mwatandika okunuma munda mwanuma katoba ajja kugundi mutoyi nabone kintu nga kigwa.
Before she had time to recover emotionally, she conceived again. Sadly, history repeated itself. Never sought medical care. Instead, relatives encouraged her to use traditional herbs, commonly known as kamunye, believing they would cleanse her womb.
Nasigala nga nkozesa kamunye. Nali ndya olubuto olwokusatu ntunanga lwida. Embuto dava mu 3. Luna walwida. Olulwali lujaweza mulala kitundu awo, tiwaweza myezi 2. Andi awo nga muda mutandika okunuma, munda omwe ebisenga obona nti omwana ali kuluma. Munda mwanuma era nali ndya wopa. Nga musaayi nga luvaamu. Okulira munda nga muda muli kunuma, okujja ku mudawe bankobozera buzibu neira waka. Olwire waka era nali ndya awo nali nambe na josuka nga mbona musaayi.
Although she reached the hospital, Annet says she only received pain medication before returning home.
Mwidwaliro bakoba era yo jofune kujonwa amadi amasujja jonwa amajani jofune kamunye wenige munda bijakolera mwidwaliro ezirabwidda ndabibuli awo bwe basobola okukolako era bakoba yo mwene bwekubirize okozese kino okozese kiro.
Experience reflects the challenges many women face after pregnancy loss, including delays in seeking care, misinformation, and limited understanding of post-abortion services. Health experts say timely medical attention can save lives. According to Dr. Namala, pregnancy loss has different causes depending on the stage of pregnancy.
Pregnancies that are lost when they are still very young, like below 3 months, have different causes that make them come out, which are different from the causes that make the bit of the older ones also come out. But all this we assess the patient and choose and then manage according to the cause.
She says the Ministry of Health has developed a comprehensive post-abortion care package that not only treats immediate complications but also prepares women for future healthy pregnancies.
But we are going to look at this patient when they come and they are losing this pregnancy, irrespective of the cause. We have a whole package that is called post-abortal care that the Ministry of Health is encouraging. And this whole post-abortal care looks at not just sorting the current problem of this patient, but also taking care of the next pregnancy and also giving the uterus some time to rest.
Bleeding during pregnancy remains the most common danger sign.
The commonest symptom of losing a pregnancy is bleeding. We expect a woman who is pregnant not to bleed. So once you're pregnant and bleeding, it is not good. So that is usually the commonest symptom, and most times we need to confirm with an ultrasound scan, which we have in Ginger Regional Referral Hospital.
Let's use ultrasound scans and clinical examinations to determine whether a pregnancy can still be saved or whether emergency treatment is needed.
So we do your ultrasound scan and confirm the status of your pregnancy. Remember, this is a very small pregnancy. As pregnancies are bigger, we can use maybe a fetal scope and we hear if the fetal heart is there. But when the pregnancy is very small, we need an ultrasound scan to check the status of the baby. So after we confirm that you're losing this pregnancy, sometimes we use medication, other times we take you through a surgical procedure to remove what has remained of this pregnancy.
Treatment may involve medication, surgery, or both.
Of course, it's important you see your doctor and they make for you a proper prescription. So there are drugs we can use to totally empty this uterus of these products. But we can also do a surgical procedure where we have to take you to theater or a procedure room and remove the remaining products.
One of the most common procedures is manual vacuum aspiration, commonly known as MVA.
The easiest of those surgical procedures is what we call an MVA, which is a manual vacuum aspiration. This one can be done by even the lowest of the cadres, as low as the midwives. We have trained health workers who are performing these MVAs. It's not like it's only a consultant, a gynecologist who does the MVA. Even the medical officers are doing MVAs, or intern doctors are doing MVAs, and the midwives have been trained because of the burden.
At Jinja Regional Referral Hospital alone, an average of 5 women seek treatment every day after losing pregnancies.
Averagely here, we get a minimum of about 5 people who come in when they are losing pregnancies on a daily basis. Daily, at least 5.
Experts say many of these complications could be prevented through early treatment and increased public awareness.
Bringing this service closer to the people. Bringing the service closer to the people, where we should at least have even postnatal care done to a level as low as a health center 3, because a health center 3 has a midwife, and we expect it has these beds and we just need to ensure we train the staff, we equip the facility, and we also provide the sundries that are needed. But also on top of all that, for the development partners, it's important to utilize the different information sharing, the different modes of communication, the media, social media, TVs, radios. We share this information and sensitize the patient that they are not the first. It's not entirely witchcraft. This is a manageable condition. It happens to many and it can be treated, it can be prevented. We realize many of our patients do not want to come for antenatal care until the pregnancy is big. They come after the abdomen is very visible. Some of these problems that maybe your pregnancy is facing could have been detected earlier if you come to the hospital early, so that we can, if you've enrolled for antenatal early, they could give you medicine that could avert these problems, but they could also identify the problem and we treat it. A lot of delayed of maternal deaths have been recorded. The problem with this abortion care, one, many people go to unqualified, unskilled people to support with the termination of the pregnancy, the evacuation. Like I told you, someone has to be trained and skilled enough. However simple the equipment is to be used, someone has to be trained. So we find that many people go to unskilled people and they end up with perforated uterus. That is the time where the uterus gets like an injury. And when you get a perforated uterus, people get sepsis. Because of the stigma attached to this whole thing. Take abortions, we end up with sepsis of patients and sometimes bleeding. Some people bleed, and just the bleeding from the pregnancy loss causes a maternal death. So we've seen a number of those ones. Though they may not be as many as the ones who die when they're delivering, they are still part and parcel of us.
Community leaders are also joining the campaign. The Busoga Kingdom says teenage pregnancy remains one of the major contributors to maternal health challenges.
Busoga muno abaana baife bali kufuna endanga bakali bato era kyategeeza nti abaana baife bali kutandika okuzaala nga bakali bato. Ekyo kitegeeza nti bw'otandika okuzaala nga okali muto wona atukira emyaka ena ng'ozaire abaana bangi ino. Aye abaana abana abangi boli kuzaala osobola okubalabirira, osobola obatwala mu isomero.
Abakulembeze mu kanisa twogerera ensonga eyo nga tukubiriza abazaire okwegala okuteekeza ku luya nga galira ensonga ebaire ku baana baibwe nga batwira amabunda nga bakaali bato ensonga ezo zisobola okudigemya gavumenti